Well, Prof, good morning, and thanks for your time, and congratulations as well on receiving the prestigious Al Sumaid Prize for Research Contributions to African Development. Just tell us a bit about what that award means. What is it?
Thank you very much. It's lovely to be with you here this morning on in the lead up to World AIDS Day. So, Dr. Al Sumaid was a very famous Kuwaiti doctor who worked among the poor in Africa. And the Emir of Kuwait decided about 4 years ago to create an award in his name. And the purpose of the award is to recognize research that has contributed to development in Africa in a very broad way. And most of the recipients up to today have been organizations who have been working in Africa. I think in its history of the last 4 years, there's been one individual who received this for research on malaria. So this is indeed an honor, and I'm deeply humbled to have been selected by the group, by the panel for this award. And I'll be going to Kuwait on Sunday to receive this at a ceremony hosted by the Emir. The award itself comes with $500,000 and a medal, but I think for me it's more the recognition for the contribution that is being made by thousands of healthcare workers, researchers, and activists to really address the challenges in HIV.
Fantastic. Well, let's talk about the work that has got you there, and that to be up there in that league, Prof. And the UNAIDS report is showing some positivity, like we say, that people are managing to get it right on some level. But complacency is a big concern for you. Who is complacent, and what effect is this having? Who are we talking about? Where are they?
Oh, I think what we have seen, if we look at the HIV situation today, is that it's really an amazing accomplishment that has been made possible by so many people coming together and players coming together, and indeed a level of solidarity at a global level we've not seen before, for example, through the Global Fund. So we've put 22 million odd people on treatment, something that was sort of unthinkable a while ago. We have reduced mother-to-child transmission to levels where we are actually talking about eliminating mother-to-child transmission. So there is no question that there have been major accomplishments in dealing with HIV. The problem now comes about that the response to HIV is a victim of that success. And that people think, oh, the job's done. You know, we can take it easy now, that we don't really have a problem anymore. But nothing could be further from the truth. In reality, if you look at 2017, that there were almost 2 million new infections and almost 1 million deaths that occurred. There are still 37 million people living with HIV. And so we have just simply not conquered this epidemic. We have a long way to go. So we can't take our foot off the pedal. We've got to continue our efforts, and we've got to do better. And the key to dealing with the global HIV epidemic is to reduce the incidence of HIV in young people, particularly in young girls. And you already heard that from Dr. Esaji, that remains one of the real challenges. It's a hard nut to crack, to get the incidence rates of HIV in young people down to levels that would enable us to reach our goals at a global level of ending HIV by 2030.
Particular concern, Prof, like you say, adolescents, a big concern. I mean, those numbers that we are seeing come 2030. But we talk a lot about access to treatment, access to awareness, access to education. Surely by now, you know, we should have reached many of the places that possibly 30 years ago, I mean, we're coming up for our 30 World AIDS Day, 30 years ago, we couldn't reach. So are we actually doing enough? Are we, are the grown-ups, can I say that, are we doing enough by our youth?
So when we look at treatment, we're actually doing quite well. If we look at how we are progressing along the path to putting people on treatment. And I think there we've got much to say about positive results. However, we know, and we presented this at the International AIDS Conference in Durban in 2016, using phylogenetics, using the genetic code of viruses, we have been able to show that in much of KwaZulu-Natal, young girls are becoming HIV positive because they are exposed and having sex with men on average about 10 years older. So it's this age differential which plays an important role. It's not the only reason why HIV is spreading in young girls, but it's one of the important reasons and one of the major contributors. So in order to stop that transmission from occurring, to stop that spread from occurring to these young girls, we have to find all of these HIV positive men in their late 20s and early 30s and put them on treatment. Now that's where we've had a challenge. See, unlike the situation in women, women are interacting with the healthcare service all the time, whether it's for contraception, whether it's coming in for antenatal care or bringing their children in for vaccinations. So women have a very strong relationship coming in and out of the healthcare system. However, when we look at men, particularly men in their 20s and 30s, they have no interaction with the healthcare sector. There's no reason for them to walk into a clinic unless they have some kind of injury, and most of them are coming in either with an occupational injury or with some kind of minor illness. So we see very few men coming into the healthcare service. So it's been a challenge. Even though we're doing well in treatment, we're not doing well in treating men in that age.
All right, Prof, thank you very much. Unfortunately, that's about all the time we have.